This is Susan Langmore's study. This is the Sentinel study that looked at this issue of who gets sick. Who amongst my patients who are aspirating is likely to get aspiration pneumonia? And this was a huge study. This was a VA study as well, so this was a VA population, so mostly male, but all levels of care. They looked at a variety of levels of care, so it was a pretty large and diverse N in this study. And they found that the number 1 and number 2 risk factors for aspiration pneumonia were dependence for feeding and poor oral care. Related to poor oral care was dependence for oral care, because again, unfortunately, in so many of our facilities, if you are dependent for oral care, you're not getting good oral care. Look at the third bullet, tube feeding. Higher than the aspiration, higher than dysphagia in terms of risk for aspiration pneumonia. We have to be very careful about recommendations for non-oral feeding in our patients, because we've seen a couple of studies now that have demonstrated that the process of tube feeding may actually increase aspiration pneumonia risk. So we may not be doing our patients any favors when we put this recommendation into place. We really have to do this full assessment to see what other risk factors they have and what we can do to mitigate them. Number of medications was a predictor. That's degree of disability, right? The sicker you are, the more things wrong with you, the more medications you're taking. The sicker you are, the higher your degree of disability, the more likely it is that aspiration is going to make you sick. There's cigarette smoking, again, underlying lung disease, and altered level of consciousness. So you can see as we look at this, all of this research as a whole, that there are some clear trends that we can use then to look at our patients to determine my individual patient's risk of aspiration pneumonia.